talk a little bit about just strategies and advice for parents who have had these children home, unfortunately, for more than a year now without friends? And how do you deal with that emotional health and children during this crisis? And then I have a lot of questions from viewers as well. So take it away, Doctor.
This has been an enormous challenge for families, especially families who have children with special needs. Um, um, Parents, many families, both parents working to make ends meet, and while some of them may have been able to work from home, having children at home is really a full-time job, and so we see a lot of families in turmoil, a lot of families who are facing high levels of stress. And remember what I said about normal stress? Prior to the pandemic, kids were going to school, coming home from school, parents going to work, coming home from work. There was normal stress of everyday life. And then there would be periods when it would become higher, but it's still tolerable. In this situation, there's been a lot of toxic stress that has emerged, and stress has become more chronic and persistent, and it is straining our capacity to adapt. And certainly, children are feeling what their parents are going through, as they always do. When parents are stressed, children feel it, because one thing that's very, very important to understand about the human being is that our environment of evolutionary adaptedness, as the famous English psychiatrist John Bowlby said, is always one of secure attachment. And so children feel best at home when there's a sense of being securely attached to their parents. When parents are really stressed out about one thing or another during this pandemic, children feel that. And then they also have the added burden, if they're at school age, of learning a whole new way of learning, and spending hours in front of the silly computer. So what are some of the things that we need to try our best to do? Well, parents need to understand that they're not perfect, that their children aren't perfect. And there has to be a lot of forgiveness in the family setting these days. And we have to keep our eyes on the fact that this is not going to last forever. We just have to, as a family, get through this awful time. Sleep is extraordinarily important for everyone, for parents and for children. And keeping to a structured schedule is very, very important for children as well as parents. We have a tendency to fall out of our structured schedule. We have to create new ones if our context changes. We had an old one, but now we have to create a new one. Exercise. So having
Exercise
time,
is important.
Yes, it's still safe to go out with a mask and to as a family, make it a family event every day. So sleep hygiene, exercise, and nutrition, of course, is very, very important. The comfort food can be a real foe, not only for kids, but for parents too, when we're feeling stressed out. So those tried and true lifestyle behavior tips are really important. And then making time for relaxation response. A simple breathing technique can mean the difference in terms of losing your temper and maintaining your composure.
Right.
So there is
And I
a
was going
very
to talk
simple.
to you about meditation, which I want to follow
Yes,
up with. But first,
yes.
doctor, I want to take a video on children, the pandemic, and their mental health. Let's watch this for a moment.
Ready?
Sarah Flynn has always tried to make mental health a priority, but the coronavirus pandemic has made it harder to manage her anxiety and depression.
COVID has definitely impacted our life in many ways.
At one point, Sarah was caring for her husband who had COVID-19, their terminally ill puppy, and trying to help her twin boys learn remotely, on top of working full-time, coaching teachers.
In the moment, I think I was definitely just feeling overwhelmed. I was exhausted. I was beyond exhausted. So I don't even know that I could say I was, depressed. I was just so exhausted and so overwhelmed that I didn't even know what I felt, to be honest.
Sarah says at times she survived on autopilot, just trying to get through the day. But her psychologist at Cleveland Clinic was quick to remind her that she needs to take care of herself, too.
She had an incredibly full plate, and what we worked on is for her to really try and balance it the best that she could while also prioritizing her own needs without a feeling of guilt.
Dr. Borland says deep breathing can help the mind focus on the present. Being outdoors and talking to family, friends, or a professional can also be therapeutic.
I will always tell people that talking to somebody and having that person, that safe person to talk to about what you're thinking and you're feeling is so important. And not just for people who struggle with anxiety. In the world that we live in today, it's beneficial to anybody.
At Cleveland Clinic, I'm Erica Foreman.
A lot of valuable information there, doctor, of which we just touched upon, the exercise, family, which is really important. Meditation, does that help also? Is that something that we can incorporate to help that stress?
Yeah, absolutely, Olga. It's an essential part of the modern toolbox in many ways, and this has to do with energy. You saw Mrs. Flynn say that she felt exhausted. Persistent stress will make you feel exhausted. This has to do with the stress hormones, especially cortisol. Cortisol's job is to try to help you produce glucose for your daily life, and then it can get overproduced if you're overstressed and you're overusing glucose as a source of energy, and you can become exhausted. So this is a very important thing to take notice of. People will start sighing, for example, if they're overstressed. But so what do we know about meditation? First of all, sometimes stress comes from this sense of focusing on yourself, on maybe past mistakes or future worries. And certainly the pandemic has brought this to the fore, where we worry about the past problems we've had, and we worry about the future, maybe getting COVID, or we're suffering from grief. Maybe we've lost a loved one to the virus. And so what meditation does is it puts that self-focus offline. It puts it in the parking lot, and you wind up focusing on the present moment. And you get this swelling up of a feeling of connection in the present moment, that everything actually is okay. And at the same time, by that deep breathing approach, you are rejuvenating your energy level. You're decreasing your oxygen consumption. You're decreasing your heart rate. You're decreasing your blood pressure. Your brain is telling your body we're in a safe place. We're securely attached. We're going to be fine. And even if you do this for 5 or 10 minutes every day, as long as you integrate it into your life, it will make a difference. That's right.
There you go. And doctor, our producer was actually feeling stressed, and she watched something called a healing light guided meditation, which I know you're very familiar with. It's produced by the Benson Henry Institute. It was 10 minutes, and she said, and I'm quoting her here, that afterwards she felt the stress disappear, telling me how happy she felt. So I'd like to watch a little bit of that meditation, and we'll talk about it. Let's take a look.
This meditation is designed to restore your deep sense of safety and balance. Over the following moments, you'll be connected more deeply to your own healing prescription. In the momentary stillness of your mind, feelings such as love, patience, nurturance, and stability will come to you. You have already signaled a desire to heal. Now all that's needed is to find your way to a quiet mind where you can receive. When your life is focused on giving, receiving is needed to restore balance. To begin, become aware of what you're feeling right now. This is an expression of self-compassion, a blend of self-awareness and unconditional love. By focusing on yourself, you acknowledge your own intrinsic worth that accompanies a deep abiding desire to be free of suffering. You can begin this awareness by shifting your attention to the rise and fall of your breath, or notice any other feelings that come to you from your body.
Doctor, we only have a few minutes left, and I really want to
Yeah,
get in a couple of questions.
sure.
So if we can quickly go through them for our viewers. Does this guided meditation work for everyone? I think I would have maybe a little bit of a hard time for me, for example.
Right, right. Well, that's a very good question. In our stress management and resilience training program, our SMART program, this is one reason why we decided to teach 8 different ways to elicit the relaxation response, that physiological state of safety and calmness. So, because we feel that people want a menu of options, and there are many different ways to change your physiology to a healthier place. So don't lose heart if a meditation like this is not for you. There's yoga, there's Tai Chi, there's mindfulness-based stress reduction. There are many, many different ways to get to that physiological safe place and to reduce your stress level. And this is so
I,
important, I might say, Olga, for your inflammatory response. There are ways to reduce that kind of pro-inflammatory response that can make you feel unhealthy, especially in times of COVID.
so any final thoughts for our viewers who are dealing with stress right now, what they can do, and really, like you said, it's a little bit of nature versus nurture here, if you will.
Just say that try your best to maintain your attachments as best you can. Be creative. And remember that being pro-social, for example, doing something for someone else in a safe way during the time of the pandemic can really strengthen your sense of attachment to the people around you. And that will pay huge dividends for your health.
And maybe saying a joke once in a while and laughing a lot, right, doctor?
That's right. Humor is another great way to be attached. That's absolutely true. Thank you very much,
There
Olga.
you go. I think I should always say that because I'm always laughing at myself, and I think that's very healthy as well.
That's great.
Doctor, thank you so much for your time. I do appreciate it.
Oh, you're welcome very much. Thank you for having me.